A 20-year-old man comes in with the episode of epistaxis. An exam shows telangiectasia. CT scan of the head shows arteriovenous malformation and states that his father had similar symptoms. Which of the following conditions can be inherited in a similar way? Duchenne muscular dystrophy, Fragile X, Huntington's disease, D. Cystic fibrosis. So I'll let you answer the question and then I'll explain. Okay, so this is going to be C, Huntington's disease. So for this one, this patient specifically has HHT, which is hereditary hemorrhagic telangiectasia. So another name for this is the Osler-Weber-Rendu syndrome, and it's inherited in an autosomal dominant fashion. So this question was asking what other disease is inherited in a autosomal dominant fashion, and that's going to be Huntington's disease. So Huntington's disease presents with dementia, depression, and chorea. So chorea is just abnormal movements and uncontrolled movements. So HHT, talking a little bit more about that, can cause AVMs, or arteriovenous malformations, in both the respiratory and the GI tract. And so this can lead to bleeding and anemia. And talking a little bit about the other questions, we have cystic fibrosis, that is an autosomal recessive condition and causes defective chloride and water secretion, which leads to thick biliary and pancreatic secretions. Now, having this thick secretions in the pancreatic duct can lead to pancreatic insufficiency, which means that the enzymes necessary for digestion may not get to the digestive system. For Duchenne's muscular dystrophy, it's X-linked and can cause deletion of dystrophin. So one of the symptoms can be calf pseudohypertrophy. So these children can have very large calves, and it's called pseudohypertrophy because it's not all muscle, it's actually fat, and that's what gives it the size. And so for Fragile X, it's the most common X-linked dominant disorder and has CGG trinucleotide repeat, and is associated with long face, enlarged testes, and mental retardation. So for this question, it's you first have to recognize that it's HHT, which they kind of give it away with the telangiectasia, and then seeing the AVMs, and then knowing that the disease is inherited in an autosomal dominant fashion can lead you to also know that Huntington's disease is also autosomal dominant, and that's what they're asking. So it's essentially knowledge of two disease processes and knowledge of how both are transmitted to their offspring. And so I hope that helped, and thanks for watching.